Well, a very good morning to you. We'd like to welcome you to another episode of Health and Wellness on K24. Great to have you on board, as always, looking out for you through our social media platforms at K24 TV on Instagram, Facebook, as well as X is how you can interact with our team. We're always on standby, ready to receive your feedback, your salams, or any questions you may have in regards to our ongoing programming right here on K24. Shiko Kaitani here with you, and even as we get started, remember we're spreading the cheer and giving away money every single day, courtesy of Dumu Lotto. The instructions are on your screen, dear viewer. If you'd like to participate, anything between 50 Kenya shillings to 1,000 Kenya shillings is all you need. Send it to the pay bill number 919155 to the account K24 for your chance to walk away with 100,000 Kenya shillings. But if you want even better news, there's also 2 million bob up for grabs, and that is courtesy of our quick box promotion running throughout Media Max, okay? And in this particular case, you can win 2 million Kenya shillings by playing any number between 1 and 6 for as low as 30 Kenya shillings only. Now, once you actually have figured out how much you'd like to play with and which number you'd like to select, send that to the number, and please put this down, 23656, okay? That is 23656. Want to wish you all the best as you get started with either Dumu Lotto or QuickBox. Take your pick. All right, so today we'd like to talk about how artificial intelligence and new technologies are revolutionizing the healthcare landscape. Now, the one thing that we can definitely appreciate about tech in the health space is that services are more or less extended to neglected patients, right? And that being said, we are going to be taking this particular show, at least the opportunity on this platform, to celebrate women in health and technology as we gear up for International Women's Day. We also do want to discuss how girls perceive and perform in science, technology, engineering, and mathematics, what we simply refer to as STEM. Yes, indeed, you've heard about that. So how are they perceiving STEM subjects also in school? What is society also doing to encourage young ladies to just jump into that STEM space? Well, we are going to be talking more about that shortly, but for now, let me start off by introducing the program manager from Gertrude's Hospital Foundation. Dr. Carol Waweru is here with us today. Hi.
Hello.
How are you?
I'm fine, thank you, and thank you for having me.
Karibu sana. How is Gertrude's?
Gertrude's is good. We're busy.
Of course you're busy because kids are just there, never ending.
Oh yes, and now that schools are open,
right?
Yeah, so we have many children coming in, transferring bags to each other. Yeah.
Just another day in the office, yes. More bags.
More bags. Hopefully I will not bring any bags here.
By the way, please, we should have checked on that. All right, so tell us, by the way, about your scope of work. Maybe it's nice to understand what your department does, because, you know, we typically think of pediatric care. We know what a hospital will be doing for children, but when now you throw in Hospital Foundation, what's that all about?
So my role is taking care of the needy children.
Okay.
Who may not necessarily be able to access Gertrude services. Yeah. We understand that it's not only the well-to-do children who will get unwell, more so are the needy children. Yeah. So my day-to-day job is getting the needy children, making sure that they get the required health care. Through our pediatricians and the staff at the hospital. And we not only work in Nairobi County, where the hospital is based, we are in several counties, including the hard-to-reach counties like Samburu and Baringo and Homa Bay and Lamu and Narok as well.
Fantastic. Yeah. When did the arm of the foundation actually establish itself? Is it recently, or?
The foundation has actually been there for about 13 years. Okay. So we normally actually, we've been operating behind the scenes because
Yes.
when everyone sees the foundation, they assume it's the hospital. Since we're joined at the hip. However, the foundation mainly takes care of needy children.
Yeah.
And we also provide training and capacity building for healthcare workers, mainly in the public sector.
Okay. All right. Great stuff, Dr. Carol. If you'd like to start throwing in your questions or your comments, please do so through our WhatsApp number that's at the bottom of your screen. Specifically, even when we talk about STEM subjects in school, are ladies or young girls actually taking up the challenge to say, you know what, we're going to get into science-related fields? All right. We're curious to hear your thoughts. Start texting. In the meantime, let's talk about tech, Dr. Carol, and how it's accelerating universal healthcare. How you know, give us your thoughts on this.
Okay, this is an interesting space that I'm very passionate about. Technology, you know, cuts across all industries, and more so in healthcare. At the foundation, we've actually piloted telemedicine in different counties. And what we've seen is that technology actually helps in improving access to healthcare. There are many areas in this country that do not have specialists, even like a pediatrician. So most of our specialists, because they're not too many, they're actually based in urban areas. So we have marginalized areas that do not have specialists, and these children actually need to be seen by the specialists. So what we've done as a foundation is to leverage technology to improve access. Instead of shipping our specialists at Gertrude's and taking them to the various counties where they do not have these specialists, then we use technology for them to actually be able to attend to the patients. And through technology, we've been able to improve diagnosis of children. The children who kept on going to the local facilities, being told that they have malaria or typhoid. And yet they had, you know,
a totally different condition.
Different condition. But now by improving access to diagnosis, then they're able to get the right treatment and they're able to go back to school. The caregivers, who are mainly women, are able to continue with their daily activities. And also, just through improved treatment outcomes, then it helps to reduce the you know, death rates of these children, the mortality rates.
Wow, that's amazing. So let's understand about some of these applications, you know, when you're talking about what's on the ground. So applications of technology in healthcare today, what examples do you want to share with us? Some
of the technologies that we've deployed. So one, we have our telemedicine program, which is the Daktari Smart program. So we have partnered with the M-Pesa Foundation. And through this program, we've been able to implement the telemedicine platform in Samburu and Baringo, in Homa Bay, Narok, and Lamu counties. And we've had over 7,000 beneficiaries being able to access this platform. So how it works is that we have our pediatricians in Nairobi, and the children on the other end are able to be consulted by the consultant as well as be examined, because this platform has electronic medical devices. So like with the stethoscope that we used to have, we're used to seeing doctors having them. So when the clinician on the
other side,
at the other side is able to put it on the chest, and the pediatrician in Gertrude's is able to hear the heart sounds, for example, or the chest sounds. It also comes with an otoscope for the ear, you know, children and infections in the ear. So the pediatrician in Gertrude's is able to see the ear. It also comes with an ultrasound. So we're able to examine these children, come up with a diagnosis, a treatment plan for them. So they don't need to travel all the way to Nairobi, just looking for healthcare. And we know that for children and their parents, if they don't know anyone in Nairobi, for example, they won't follow through with the treatment.
Of course, because it's so cumbersome.
It's so cumbersome. You don't know anyone, and then the cost is just through the roof. Because they need to look for bus fare, for food. I mean, for accommodation. So just through lowering the cost of treatment, then they're able to follow through with the treatment plan that they are given at the comfort of their home.
Yeah.
And if they need review visits, then they're able to just go to the facility in the counties, and they're able to actually be able to go through the consultation process. If they need to change the medication, they change the medication right from the comfort of their facilities.
Right. Yeah. And, you know, when you think about it, just, you know, broadening the conversation beyond pediatric care.
Yes.
I want you to really talk about it from even the health professionals aspect, about how positive the impact of tech being integrated with healthcare has been, even for professionals.
Oh, yes.
Yeah, so what's the sunny side up for you guys?
I mean, we've received very good feedback from my colleagues, because the healthcare professionals, they're able to access children that would normally not come to them. Not even just because of the cost of treatment, but also in terms of distance. So they're able to spread their tentacles, you know, to all corners of this country through technology. So they're able to see the impact of their services.
Right.
And also just being able, we've been able to see very interesting cases out there. So we would think that maybe patients in a certain region don't get a certain disease, but it's because no one is diagnosing.
Right, and then they are wrong diagnosis.
And the wrong diagnosis. So we are getting interesting data also in terms of the different regions and what people are suffering from on the ground.
Correct.
And we're using now this data also, sharing it with the government as well, the Ministry of Health, so that they're able to, you know what kind of illnesses are affecting people on the ground.
Correct. And I think for every single person, if you've obviously walked into a hospital, what's the number one thing you think about? The consultation cost. Think about how AI and technology is dropping consultation fees for even the patient. I think for me, that is just such a win, you know? Because the daktari, you know, will obviously be able to give more favorable rates where they are from when they are using technology. Isn't that amazing?
It is amazing because you'll find that through the telemedicine platform, the cost of consultation is slightly lower than you know, when it's a physical consultation.
Right.
Yes, which patients get to actually appreciate.
Tell me about the kind of critics that you would probably receive who say, we definitely need to have a one-on-one. Like, it's not being seen by a professional if it's not one-on-one.
Yes, I mean, there are those diehards who want to be physically touched by the doctor. However, I would like to say, since the COVID pandemic, there's been a lot of I would say adoption of technology, since we were forced by the pandemic to actually embrace technology. So yes, there are few critics in terms of there are issues to do with also data privacy, you know, because you see with telemedicine, we have the doctor on the Gertrude side, but then at the participating facility, we have the clinician, there's the child, there's the mother, there are one or two people helping with the technology. So there are privacy concerns. However, this is something that we're addressing in terms of just having the right people in the room. Yes, and also seeking consent before the consultation.
So sensitizing people to also such matters that, yes, your information is safe. Okay. I'd like to just pick your brain on what you've seen out there. It's always nice to compare different markets, because you're in that space. You obviously do know what's happening in the Western world, in other parts of the continent. And when you think about it, maybe you can tell us which markets have very great integration and adaptation of tech in healthcare, what the penetration actually does look like on the ground in different markets. I mean, which countries stick out to you and have really impressed you as a doctor?
Okay. Naturally, we've I think tried to benchmark with the US. Especially just because of the wide range of technologies out there, including AI, which helps in reaching a faster diagnosis. So that's what sticks out, and we're, you know, even as we develop local solutions, you know, for our local healthcare market,
Yeah.
then you know, we try as much as possible to benchmark with nations like the US.
Right.
And also when it comes to legislation as well, we try and borrow from what they've done.
Yeah.
Since they are a few steps ahead of us, but we're playing catch up and
few steps ahead
a few steps. Because I think Kenya has made good strides, and you know, very soon then we'll be able to also you know, reach where they are.
Right. And maybe you can, you know, just trying to understand it, you know, from behind the scenes. Do you think that healthcare here is struggling to adopt the kind of tech that's abroad? Are there roadblocks to accessing this kind of technology to be brought in the country?
Yes, naturally we have several challenges.
Right.
They range from you know, financial, just developing these technologies. It's expensive.
Right.
Since we're dealing with human life, so we you know, we don't want to make any mistakes. So development of these technologies is expensive, and in as much as other countries have the technologies, we need to adopt them to, you know, our setting. And secondly, also some of the challenges that a lot of developers have locally is we need like a hub, you know, an innovation hub where we can encourage our young people to innovate and develop their own technologies. I think this needs to be encouraged more and developed.
Right.
And it's something that also we are lobbying with the Kenyan government as well, because we need that infrastructure to be able to invent and innovate. And thirdly also is there's the aspect of, you know, in some areas in this country there's poor internet coverage.
Right.
So if, in as much as we want to adopt technology, engagement of our community health promoters in certain areas in the country, you know, they may not have that internet technology to be able to relay information and use the technology. And
I think this is even, you know, where it boils down to something as simple as either reviewing some, you know, what the government's progress is. It gets down to even who you're placing in government, because when we talk about our political leaders, our county bosses, even those who are obviously on the national level, how far or what are we doing as a nation to be able to reach such heights? Because when you look at someone like Dr. Carol trying to achieve and also helping a child who's in Samburu, for example, you ask yourself, what does it take for that healthcare professional to get that service out there? There obviously needs to be support systems and things working, structures in place for all of this to be effective. So it breaks my heart when you hear things like, oh, there's poor internet. You know, or there are no poles, you know.
Because I mean, even electricity.
Even power
is an issue, because I mean, they need to charge their phones, for example.
So your community healthcare promoter on the ground is telling you, I can't help because hatujakuwa na stima for 3-4 days, which means a backlog of patients. Oh, that is so sad.
But I think a lot of strides are also being made. So we'll give this government time, so that a lot of things are ironed out. I know there's the Digital Health Act that was passed last year, and this is just you know, it shows that the government is thinking about technology and also use of technology, where we'll move from curative services to preventive and promotive services. Because right now I know a lot of technology is towards the curative, you know, following up on, you know, people with chronic conditions and helping to diagnose people who are already sick. But then now there's that shift where we need to move towards, which is now more of preventive and promotive health. So use technology to be able to, you know, make sure that you don't get sick. So this is at the forefront, you know, thinking about preventive and also technology as we speak. Okay, that's good to know. And I think even just to expound a little bit more on policies and suggestions that, you know, the healthcare professionals or the medical fraternity have floated. What can you tell us, you know, that's actually being requested from the professionals
to the government, to the key decision makers, who will decide, okay, this is how we are going to move going forward.
Yeah.
Yeah.
So as a follow-up to the passing of the act,
Yes.
now of the bill, now it's an act. So the Digital Health Act actually has different areas that it will be looking at. And the good thing is developing of the bill was multi-sectoral. So both the private and public health sector. So at least I'm happy to say that the private sector was not left out.
Yes.
So there's a roadmap, and as part of the universal health care. And so the roadmap basically just looks at everything from teleconsults to actually electronic medical records and unification of health data, so that no matter what facility you go to, then you have your health records intact. You don't need to start the story all over again. I know that has been a big issue, where people start from their local facilities. By the time they're getting to the referral facility, they have to repeat tests, which is very expensive, changing of drugs. So that means it affects also the treatment outcomes. But now if we have our health records in one place, and now you have your unique identifier, so that wherever you go, you're able to access your data, health data, and continuity of care is actually quite key. So I know this policy will be able to address that. We hope, in the next, few years, we'll be able to have achieved what we wanted with the Digital Health Act.
All right, thank you so much for that, Dr. Carol in studio with us today, helping us understand just how critical technology is in healthcare today. I hope, by the way, it's sinking in, and you can really tell, by the way, why we need to be at the forefront of pushing for tech and better services out there for people, especially who are in very marginalized areas. You can see what technology is doing and changing lives across the board, right? And so when we take this short commercial break, we'll get back and also be sampling some of your feedback. We also want to actually take a look at the aspect of the perception around STEM subjects. How are also women viewing these technical courses? Are we doing better? Are we seeing more women, or female representation when it comes to science-related careers? That's a very exciting space, and Dr. Carol is one of them, so she'll be giving us her thoughts on that. But go ahead and text us through our social media platforms. You can contribute online, or you can send it through WhatsApp. By the way, you can see our handles and our WhatsApp scrolling at the bottom of your screen. As you get to work on that, let's remind you about Dumu Lotto, currently ongoing. We've got 100,000 Kenya shillings to give away. And so there are the instructions on your screen. As I always like to say, it's pretty simple. You can use whatever you want between 50 Kenya shillings to 1,000. I guess your M-Pesa will dictate how much you can put into Dumu Lotto, but feel free, okay? Send that to 919155, the account being K24. Today could be your lucky break, FYI, and if you win the 100K, please usitusahau sema, by the way, Media Max K24 walini sort. Let's take that short commercial break. We'll see you on the other side. Thank you so much for sticking with K24. Shiko Kaitani here with you on Health and Wellness. We appreciate your feedback, your salams that are coming through our platform. A big thank you to one James Mushai, who actually is watching the show. He says, Shiko, you're doing such an amazing job on TV. Man, Mr. Mushai, we appreciate you. Thank you so much. And Salimia, everybody from Kiambu County, we appreciate you. Keep them coming, keep them coming, keep them coming. Remember, QuickBox also here for you to participate in. 2 million Kenya shillings up for grabs, and it's pretty simple. For you to scoop that 2 million, Bob, play any number between 1 to 6 for as low as 30 Kenya shillings. And send that, by the way, once you're done, to 23656, okay? That is 23656. All the best with that. As we jump back into our health and wellness discussion, we are focusing on women in health and technology. We're so happy to have the program manager from Gertrude's Hospital Foundation, Dr. Carol Waweru, here with us. We'll be sampling your feedback shortly, but we also want to introduce something new to you on health and wellness. I'm pretty excited about this. We thought about it and said, how best can we go to support, by the way, initiatives out there, okay, that we obviously know about, that people have been texting about, that you can participate in, you can plug into, or you can even support, not necessarily even financially, but just through your participation, your love and support. And so we'll be actually putting out wellness events every Tuesday for you to know about, that you can take part in. Okay, and not because I'm actually there as the host. Honestly, this is actually coming up. You can see Beyond the Polish, and this one is focusing on endometriosis, okay? Courtesy of Endo Sisters East Africa, there will be an event celebrating 5 years of the Yellow Nails movement and all the fierce endometriosis warriors. So this is taking place on the 27th of March. The venue is going to be at Minshak in Kilimani from 5 p.m. to 8 p.m. There's lots of activities ongoing, and also listening to the panelists who are going to be talking about the condition of endometriosis, experiences from endo warriors. It's all going down. You can see the ticket pricing on your screen, from 1,500 Kenya shillings to 2,000 Kenya shillings at the gate. All right, Bonadan, what do we have up next? All right, I do understand we have one more event known as the Malaika Disability Walk. Let's see that, Dan. There you go. I do know Daddy Owen is behind the Malaika Foundation, and there are a lot of celebrities who are actually involved in what's coming up on the 9th of March. Even as we're celebrating International Women's Day, you can also do something for people living with a disability by taking place in the Malaika Disability Walk. So this is going to be kicking off from Carnival Grounds on the 9th of March from 8 a.m. to 2 p.m. There are details on how you can pay and, of course, participate or donate. Be sure to go online and take a look at some of these events taking place. And should you wish us to let the rest of Kenya know about an event that is wellness related or health related, please let us know. We'd be happy to post that up. All right, Dr. Carol, welcome back. Now, we are just so excited because you're here to represent the ladies in health and technology. Just starting off from your story, how well did you do? What were your key strengths academically before you actually decided to get into, can I say, is it pediatric care, which is your specialty?
Right. Mainly, I'll say healthcare.
Healthcare, okay,
yes,
yeah.
Yes. So I'll say I'm old school, so yeah, it's been many years since I was in high school. Yeah, I had strengths in sciences and in maths. So naturally, I think after KCSE, then after my grades and all that, then definitely the option that was available at that time was medicine.
Right.
However, I also had an interest in technology. So back in the day, if you were joining a public university, so I was in the University of Nairobi, so I had to wait for 2 years before joining. So yeah, I'm a bit old school.
But you're here now,
Yes, I'm here now. So during the 2 years, then I did a diploma in IT.
Okay.
Yeah, so I think my interest in technology started way back. So I did a diploma in IT before joining medical school.
Okay.
And after medical school, I actually worked in telecommunications.
Oh, this is interesting.
Yes,
now you can see how they are all, you know,
Yes,
integrated.
Integrated, yeah. So even before joining Gertrude's, I was from the telecommunications industry.
Fantastic.
Yeah.
Yeah.
Yeah. So naturally now when I joined healthcare,
yeah,
then I wanted to see how I can, you know, bring in technology into health.
I don't know if you're, you know, very familiar or you remember about some of the results that obviously went nationwide, you know, thinking back to even a year like 2022. This is interesting. I just came across this about the Kenya Certificate of Primary Education examination results. Check this out. Female candidates at that time performed better than males in English, Kiswahili, and Kenyan Sign Language. The boys, however, performance in mathematics, science, and social studies and religious education was exemplary. Okay, that's the classification. But then my director is bullying me and telling me, Shiko, mi hata nilijua sciences kwako. Sasa Dan, you're working in media. Na wewe unaniambia maneno ya sciences. Kwanza you did well in religious education. So how does it make you feel, obviously, when you're still coming across this kind of data, that there's a lot of perception out there that girls feel like, oh, I don't know if I can do it. This, you know, there's also that thing that it's just reserved for the boys. And I think with that, even the boy child is even doing better because they're being encouraged. Go for it, do the sciences.
Yeah.
Yeah.
I think the observation I've actually made is that girls in urban areas are doing better in STEM because of also the exposure, access to mentors, as opposed to girls in the rural areas, where, you know, girls in the rural areas are trying to balance between if they will make it to school or not, and household chores, and also the expectations in the local community that, you know, why concentrate with school yet, you know, that all this other work that needs to be done. And then definitely we can't forget about early marriages as well. Right. Like some areas where we are working in Narok, I realized that if I was in that setting, I would be a grandmother, for example. Because you find that if you get your first child at 15, and then your daughter gets a child at 15, that means at 30 you're a grandmother. Very true. You know, so I think there's issues with, you know, inequality in terms of even where the girl child is. And I know there are a lot of people working in that space to try and bring up the girl child, especially in the rural areas, so that they are able to get that exposure. And I mean, there are many girls out there who are good in STEM. It's true. And that will pave way for them to access such education.
All right, let's take a look at some of the feedback that we did receive. FYI, just recently we marked the International Day of Women and Girls in Science, which was in the month of February. But listen to what the Chief Executive of the Engineers Board of Kenya, who is a woman, Margaret Ogai, said. She went on to describe the situation as bad, saying that the situation of women and girls in STEM in Kenya is bad, in her quotes, meaning there's so much more that we need to do. All right. First text message, Dan. Who do we have contributing to our discussion? Okay, I can see a Dixon here from Nakuru who says, hi Sheiks, the problem starts at the family and community levels where girls and boys are assigned roles, with the former concentrating more on caregiver duties. Oh my God, you just said that. Okay, Dixon, thank you. Good observation there. Annette, hi darling. You are watching from Loresho. I'm going to say that it's sad that girls are encouraged to stick to their lane. I, for one, enjoyed games that were being played by boys, but you are always told certain things are for your brothers. The same goes for sciences, where we fanya home science. I like that, Annette. Good one, good one. All right, Karen, good morning. As a woman in a science-related career, I would like to encourage all young ladies and parents to focus on the academic strengths and capabilities of the students and encourage them to head towards a science-related career. We need more women in science. Happy International Women's Day. And to you.
Yes.
Okay, what about the last text message? I think I've seen one from Embakasi. Yes, okay. This one is Lazo. Okay, Asante Sana. Going on to say, nice topic, Shiko. Thank you, Shukran. Wishing you ladies a good International Women's Day. That's IWD. Lakini, why do you women limit yourselves? Do women encourage women to get into STEM spaces? Actually, there are hardly any female role models for girls to emulate. Very, very true. Thank you, Lazo, and thank you for the text messages that we received on our social media platforms. We always like to throw out our topic also in advance, and we see you responding. But what we really picked out was what's happening from the onset. Before we even talk about careers, it's how are people receiving, you know, the idea of women getting into these spaces. And it all starts with society's perception, Daktari, like you had said. But anyway, maybe you can actually go on to just talk about what more we can do. Now that we're even approaching International Women's Day, what more, first of all, can we do to encourage girls, you know, practical steps? And then number two, women and girls still facing challenges to accessing healthcare is also another thing I would like you to tackle. So yeah, go. Let's start off with the first one.
Thanks, Shiko. So I would say that first of all is getting girls in school. Number one.
Yes.
That is like the foundation.
Yes.
Let us get as many girls as possible in school and keep them in school.
Yes.
Yeah, so don't get them out when they're 12 or 15 to go marry them off. Let us keep them in school. And then from there, we'll be able to actually see where their strengths lie. I know in the education sector, there needs to be a bit more investment in terms of like the science labs and all that, so that even those who have the interest in STEM can actually be able to hone their capabilities and their interest. And the third thing that I would talk about is scholarship opportunities for girls.
That's a good one.
Because we know there are a lot of girls who are out of school, because they're not able to afford school fees.
Correct.
So scholarship opportunities for girls, so that they're able to, you know, continue with their STEM career, you know, from an early age. And I believe in the job market, there's a lot of opportunities for women and girls. And the only thing is just work hard, you know, just work hard, be good at, you know, what you're doing. And I believe the, you know, the sky is not even the limit.
You've said two things, even in the 6 minutes that we have remaining. Number one is that when we keep the girls in school, what stood out to me is the role of the parent in this particular situation, and how it's so important for you as the parent to encourage your girl to stick to her academic capabilities. We're not saying the ones wale wako na home science skills ati wako na ubaya.
No.
But the ones who are actually focused on the sciences. Speak, you know, from a parent's perspective. What would you like to tell parents who are watching today about encouraging their kids?
I mean,
their daughters, that is.
Yes, their daughters. I mean, I'm a mom myself, and one thing I will say is we have a big role to play in terms of giving our children a brighter future. And one is knowledge is power. So just let's keep our children in school, no matter the circumstances, no matter how the economy is. You know, do not gamble with education. Knowledge is power. Let us keep our children in school. Let us sacrifice for them. Let them stay in school. Point
number two that also stood out to me was about the equality within families. I think one of the things I remember even my mom telling me growing up is that she really had a passion for doing sciences, and for her she wanted to get into that field. You know, she would have been a doctor, but because, as usual, it is always financial, you know, restraints, or there's always the preference for the boys to go to school first. You hear a lot of that with our older parents. You know, our grandparents, our moms and our aunties will tell you, oh, you know, a lot of families said, the brothers have to go to school.
Yes, and it's unfortunately it's happening even today.
Oh, wow.
Yes,
Yeah,
yes, especially you know, in some parts of the country that's still happening.
Yes.
So I mean, there's a lot of engagement and a lot of community engagement on the ground, you know, to try and change this perception.
Right.
So that whether it's a boy, whether it's a girl, let them all stay in school. Fantastic. I would like to thank my mom. I mean, she's, you know, she was a civil servant, but she sacrificed all she had.
Right.
Yes,
oh,
yes.
Fantastic.
To make sure that I go through university education and finish. Yeah.
All right, we love it, we love it, we love it. As we say, Kwaheri, how would you like the public to plug into the foundation? Can we be friends of the foundation? And your personal message to the ladies watching for International Women's Day. Yeah.
Yes, so an encouragement I'll give to the ladies is, I know we ladies are very passionate and we are very resilient.
Yes.
So let's keep doing what we can. If there's a certain area that is male dominated, do not shy away.
Yeah.
You know, just keep at it. And also use social media, market yourselves. I like encouraging women. I like supporting women.
Yeah.
You know, if it's a woman-owned business, I'll be there, you know, supporting them as much as we can.
Okay.
Yes.
All right. And for the foundation?
And for the foundation, yes, we welcome friends to the foundation.
Yeah.
We have a charity walk coming up on the 17th of March. It's a Sunday.
Let us know. We'll put that up.
Yes, yes, at Uhuru Gardens.
Okay.
T-shirts are going for 1,500 shillings. And our theme is helping children fight cancer.
Fantastic.
Yes, so T-shirts are available at all our Gertrude's clinics. So yes, come one, come all. Please join us. Yes.
Thank you so much, Dr. Carl. We appreciate you. Our love to everyone at Gertrude's. And by the way, we thank them so much for all the work they do for our totos. I mean, it's not every day you'll find people who can handle that many at a go. And so we appreciate the work that you do. Thanks so much for making time this morning. All right, programs manager there from Gertrude's Hospital Foundation, Dr. Carol Waweru, joining us as we celebrate women in health and technology, and also just understanding what technology has done for us on the healthscape, rather than healthcare landscape, rather. And so with that, if it has been informative, you've enjoyed this particular discussion, let us know. As we say Kwaheri and hand over to Sarah Ibrahim and Ann Stella on Interactive, we do have a winner, and this one is a bonus winner, I understand, through Dumu Lotto. Dan, this is 100K. 1K. Aye, you're playing with our emotions, Dan. 101. Okay, fine. Put him. Good morning. Who am I speaking to?
Morning.
Hi.
Hi.
Oh, I love you already. You're just like me. You're so bubbly. Hi.
It's a good morning.
It's a good morning. Okay, before I get your name, let me ask my team to just pump up the volume so that I can hear you better. Dan, tafadhali, let's work on that audio. Hello.
Hello.
Okay, now I can hear you. Who am I speaking to?
Nancy.
Nancy.
Yes.
Hi, sweetie. Where are you watching from?
From Kericho.
Kericho, fantastic. The land of good tea, great tea.
Kabisa, amazing.
Okay, well, I hope you'll be sending us some of that chai we enjoy from Kericho. We would like to let you know that you have won yourself 1,000 Kenya shillings courtesy of Dumu Lotto. Wow, I love the energy. If let me tell you, you're the kind of people we like, because if we give you 1,000, I want to know what you do or how you'd react if I gave you 100K.
Imagine, don't even try and imagine that. Don't.
Okay, Nancy, that opportunity might come up, but don't stop playing Dumu Lotto, okay? Today you won 1,000 bob. Next time you could be walking away with 100K. Sawa?
Kabisa.
Kabisa, Mama. Congratulations.
Thank you.
Okay, mwah. Have a good day.
You too.
All right, bye-bye. All right, Nancy, they're really happy about winning her 1,000 bob. I'm sure it's going to do something for her in the course of the day, whatever it may be. I mean, that's just the beauty about having the financial resources. You can decide what to do with that money. So 100K will be given out hopefully in the next hour. We want to encourage you to keep playing Dumu Lotto. You have seen the instructions on your screen. It's pretty simple. For me, Shiko Kaitani, all I'll just say is thanks so much for watching. We'll see you bright and early tomorrow on K24. Have a wonderful day up ahead. Interactive is up next.